My name is Dr. Asad Dean, and I'm a board-certified hematologist and oncologist.
I'm Dr. Trevor Feinstein. I'm board-certified in hematology and medical oncology, and have been practicing for over 19 years. Now let's take a look at the study design of LUNA-3. WAYRILZ was evaluated in a robust phase 3 trial called the LUNA-3 that included adult patients with chronic and persistent ITP. A total of 202 patients were randomized 2-to-1 to WAYRILZ at 400 milligrams twice a day or placebo. So 133 patients were randomized to WAYRILZ and 69 were assigned to placebo. The first part of the study was to assess a platelet response by week 13. So the defined definition for a platelet response was a patient having at one time period in the first 12 weeks of a platelet count greater than 50,000 or a doubling of the platelet count to get at least 30 to 50,000 in the absence of rescue therapy. At week 12 or at week 13, 64% of patients receiving WAYRILZ were responders, compared to only 32% of patients on the placebo group. So patients who were responders were then able to go on to the second part of the study. Non-responders had the either option of dropping out or going on a open label period where all patients received WAYRILZ at 400 milligrams twice a day. Now let's go back to those who are platelet responders. Remember, this is having one platelet count greater than 50,000 or 30 to 50 with a doubling in the absence of rescue therapy. So patients who had one platelet response went on to the second part, so the next 12 weeks. And what the primary endpoint was assessing for a durable response. And the definition of a durable response was a platelet count greater than 50,000 for at least 2/3 of the 12 weeks, or at least 8 for non-missing week scheduled in the last 12 weeks, and you had to have 2 platelet counts greater than 50,000 in 2 of the last 6 weeks, in the absence of rescue therapy. The LUNA-3 enrolled a patient population that was well matched between WAYRILZ and the placebo group. The key inclusion criteria included patients who were 18 years of age or older, patients who had persistent or chronic ITP, patients who had an insufficient response to therapy, or were ineligible to standard of care. To qualify, patients had to have a platelet count less than 30,000, stable concomitant corticosteroids or TPORAs were allowed, and what's unique about this study is patients with prior thromboembolic events were not excluded. The median age was in the mid-40s at 47 to 46. There was increased female prominence, and the median baseline platelet count was around 15,000. Prior splenectomy occurred in about a quarter of patients. The LUNA-3 included a wide range of patients with persistent or chronic ITP, including those with an insufficient response to 1 to 2 therapies. So let's look at the prior therapies. In the WAYRILZ arm, about half of patients had 5 or more lines of therapy. However, a third of patients had only 1 to 2 lines of therapy, which is with the indication for WAYRILZ, which is a patient who had an insufficient response to a prior treatment. Now let's look at the treatment arms. So only about 40% of patients had WAYRILZ by itself. About a third of patients had a TPORA with WAYRILZ, and in those who are having a TPORA, about half of those had corticosteroids with the TPORA, the other half had just TPORA by itself. Another quarter of patients had just corticosteroids that were stable with the WAYRILZ.
All right, well, thank you for laying out the schematic of the study design and how our primary endpoint was defined. We will now look at LUNA-3 efficacy. WAYRILZ did lead to durable and rapid platelet responses. In fact, the primary endpoint of durable response by week 25 was achieved. And in the WAYRILZ arm, it was 23% in comparison to the placebo control of 0%. So primary endpoint was met, but additional endpoints included secondary endpoints in terms of time to first platelet response. For all WAYRILZ treated patients, it was 36 days. And for those who were WAYRILZ responders, it was 15 days, and it was never achieved in the placebo arm. With regards to the number of weeks with platelet response, we see 7 weeks in all patients treated with WAYRILZ. In the WAYRILZ responders, it was 11 weeks, and it was less than 1 week in the placebo arm. So the trial demonstrated that the primary endpoint was met, favoring WAYRILZ. Now, I want to spend some time on the median platelet counts throughout the double-blind and the open-label periods. We will first look at the double-blind period. And here you see in yellow, of the 133 patients in the WAYRILZ arm, 31 were durable responders who achieved platelet counts approaching 120,000. In the teal, those are the patients that were non-durable responders, and those patients were 102. And although they did not meet the primary efficacy endpoint of durable response, they did have platelets that were above 30,000. Now, let's look at the open label period for WAYRILZ. And here you see that there was a sustained response and continued improvement and platelets rising over time. But what you also see are those patients who were the non-durable responders. 74 of those patients remained in the open label, and 10 of them were the patients who had platelet counts that were above 50,000. So we saw a delayed response, and that patients who may not have initially had a response to WAYRILZ did demonstrate a response. And looking at post-hoc analysis, specifically modified durable response. So let me define modified durable response. By IWG criteria, it was having a platelet count greater than or equal to 30,000 or doubling from baseline in the absence of bleeding. For duration of greater than or equal to 50% of the assessments in the last 12 weeks in the double-blind portion of the trial and the last 16 weeks of the open-label trial. So look at the bar graphs. The WAYRILZ patients in the double-blind portion were 34%. But those who only received 1 to 2 prior therapies, which Trevor pointed out were about a third, they had a higher percentage response at 44% in terms of modified durable response. We see the same information recapitulated with the double-blind and open-label period, with all WAYRILZ patients having a 50% modified durable response, but 64% for those with 1 to 2 prior therapies.
But I'd like to ask you a couple questions there from that information. So WAYRILZ is indicated for patients who have had an insufficient response to previous therapy. What does a previous therapy mean to you?
You know, based on ASH guidelines and certainly our own clinical experience and how we were educated, corticosteroids are frontline. But 80% of patients are going to fail corticosteroids. They're going to have to go on to a second-line therapy. So to me, an insufficient response is defined right there. And that WAYRILZ is an opportunity and an option to incorporate in your treatment armamentarium due to that insufficient response to a previous treatment.
I'd like to expand on that a little bit. I think that's key is to look at platelets, but as we've seen here is that we can look at WAYRILZ in an insufficient response in regard to quality of life, in regard to bleeding, in regard to thrombotic events. So these are all other things that we can think about a insufficient response.
Well, Trevor, that's a great lead into what you're going to talk about,
Yeah.
because I would say that, yes, what was unique about the LUNA-3 trial also is that they incorporated analysis regarding quality of life. And it's the first phase 3 trial to do so.
Let's explore what patients report about health-related quality of life before and after taking WAYRILZ. ITP-PAQ is a validated disease-specific health-related quality of life questionnaire that was developed to assess a range of issues impacting adult patients with ITP. This has 10 different domains and 44 items in those 10 domains, so 44 questions patients are asked. An example of a question in the bother and physical health would be, overall, in the past 4 weeks, how bothered have you been by the effects of ITP and its treatment on your physical health? Patients receiving WAYRILZ also report improvement in a variety of quality of life domains measured in the ITP-PAQ, including overall health-related quality of life. Overall health-related quality of life increased by 10.6 points for WAYRILZ patients compared to 2.3 for placebo control.
Now let's look at the LUNA-3 safety. There is an established safety profile with WAYRILZ. And what I'd like you to see on the slide is that you do not see in the WAYRILZ arm any grade 3 or higher toxicities except one in COVID-19, as this trial accrued from 2020 to 2023. The adverse reactions that were greater than or equal to 5% and are most common include diarrhea, nausea, headache, and abdominal pain. If patients are experiencing an adverse reaction of their gastrointestinal system, have them take the WAYRILZ with food, and that may improve the tolerability. Discontinuation rates were higher in the placebo arm in comparison to WAYRILZ, and the most common reason for discontinuation was lack of response, and so that was seen in a higher percentage, 80% for placebo in comparison to 41% for WAYRILZ. There was one patient who had a thromboembolic episode in the WAYRILZ arm. It is important to note that this patient was on concomitant TPORA and had a history of comorbidities and risk factors for thromboembolism prior to study start. There were no new safety signals that were observed during the open label period. In addition, there were no treatment-related atrial fibrillation or anemia seen with WAYRILZ. So some practical management tips with regards to WAYRILZ. Some of them have already been mentioned. But it may be taken with or without food, but again, if they're having adverse reactions of their gastrointestinal system, then please have them take it with food to improve the tolerability. Take it the same time each day, swallow the tablets whole with water, do not crush or chew. Patients should take at consistent times daily, but if you miss a dose, take it as soon as possible on the same day, with a return to the regular schedule the following day. And if they miss a dose and the next regular scheduled dose, it must be taken at least 2 hours apart.
Indication: WAYRILZ, rilzabrutinib, is indicated for the treatment of adult patients with persistent or chronic immune thrombocytopenia, ITP, who have had an insufficient response to a previous treatment. Important safety information: warnings and precautions, serious infections. An increased risk of serious infections, including bacterial, viral, or fungal, can occur in patients treated with Bruton's tyrosine kinase, BTK inhibitors, including WAYRILZ. Fatal pneumonia occurred in one participant treated with WAYRILZ in the LUNA-3 trial. Other serious infections, one each 0.8%, included COVID-19 infection, wound infection, urinary tract infection, and kidney abscess. Monitor patients for signs and symptoms of infection and treat appropriately. Hepatotoxicity, including drug-induced liver injury, DILI. Hepatotoxicity, including severe, life-threatening, and potentially fatal cases of DILI, can occur in patients treated with BTK inhibitors. Elevations of liver transaminases occurred with WAYRILZ in the ITP clinical trials and were generally mild to moderate in severity. Evaluate bilirubin and transaminases at baseline and is clinically indicated during treatment with WAYRILZ. For patients who develop abnormal liver tests after WAYRILZ, monitor more frequently. If DILI is suspected, withhold WAYRILZ. Upon confirmation of DILI, discontinue WAYRILZ. Embryo-fetal toxicity. Based on findings from preliminary animal reproduction studies, WAYRILZ may cause fetal harm when administered to a pregnant woman. Verify pregnancy status of females of reproductive potential prior to initiating WAYRILZ treatment. Advise females of reproductive potential to use effective contraception while taking WAYRILZ and for 1 week after the final dose. Adverse reactions. Most common adverse reactions reported, incidence of greater than or equal to 10%, were diarrhea, nausea, headache, abdominal pain, and COVID-19. Drug interactions. Avoid concomitant use of WAYRILZ with strong or moderate CYP3A inhibitors, which increases the risk of WAYRILZ adverse reactions. If short-term use of these inhibitors cannot be avoided, interrupt treatment with WAYRILZ. Avoid concomitant use of grapefruit, starfruit, and products containing these fruits, and Seville oranges with WAYRILZ. Avoid concomitant use with a strong or moderate CYP3A inducer, which may reduce WAYRILZ efficacy. Administer the dose of WAYRILZ at least 2 hours before administration of an antacid or histamine H2 receptor antagonist. Avoid concomitant use of proton pump inhibitors with WAYRILZ. Concomitant use of acid-reducing agents may reduce WAYRILZ efficacy. Rilzabrutinib is a moderate inhibitor of CYP3A and increases exposure of these substrates. Monitor for adverse reactions and consider dosage adjustment of the CYP3A substrate. Rilzabrutinib is an inhibitor of PGP, BCRP, and OATP1B in vitro. The effect of concomitant use of WAYRILZ with OATP1B and BCRP substrates has not been established in clinical studies. Monitor for adverse reactions of the concurrently administered PGP, BCRP, or OATP1B substrate more frequently, where minimal substrate concentration changes may lead to serious adverse reactions. Use in specific populations. Lactation. Due to the potential for adverse reactions in a breastfed child, advise lactating women not to breastfeed while taking WAYRILZ and for at least 1 week after the final dose. Hepatic impairment. Avoid administration of WAYRILZ in patients with moderate or severe hepatic impairment. Child-PAQ Class BC. Renal impairment. Avoid use in patients with severe renal impairment. Please see full prescribing information.